Governor Rell proclaimed this Sunday, August 15th, Heart Disease Awareness Day. So joining us this morning to talk more about the disease and what you can do to help prevent it is Dr. Bruce Liang. He's director of the Calhoun Cardiology Center at the UConn Medical Center. Good morning. Welcome.
Good morning.
Pleasure to meet you. First, let's just discuss the basics of heart disease and what we need to be aware of.
Well, heart disease is the #1 killer in both men and women, and actually it is the leading cause of death in women as well, especially after menopause. That's when the heart disease rate catches up with that of men.
What are the causes? Like what should we be doing now to prevent this in the future, women and men?
We need to recognize there are risk factors for heart disease. Smoking, diabetes, high blood pressure, high cholesterol, family history. These are the risk factors. And obesity is also playing a role as well. And then the signs and symptoms of heart disease.
And what are those?
Typically chest discomfort, pressure, heaviness, sometimes radiating to the left as well as the right arm. But it could also be shortness of breath. It could be an indigestion feeling. It could, in women, for example, be a back pain or jaw pain or toothache. And they go to see a dentist. They thought that there's something wrong with their teeth.
Really?
Yeah, but it's a reflection of what's going on in the heart or circulation to the heart.
So when do you know, when is the right time to go in and get checked for a man or a woman?
Well, recognizing the risk factors and the symptoms, and if any of the symptoms occurs, see the doctor right away, and they will take a detailed history and do a physical exam, and if necessary, do a stress test.
Okay.
And the stress test will be the best non-invasive way to expose circulation blockage to the heart.
You said diabetes might be a sign. If you are a diabetic, what should you be doing now to prevent heart disease in the future?
Certainly exercise, diet, keep that sugar down. There's a thing called hemoglobin A1C, which measures over time the level of sugar in the blood. And diabetic patients should be taking a cholesterol-lowering drug, even if they don't have any symptoms of heart disease.
Real quick, there's an event going on Sunday called Charlie's Ride. Do you want to talk about that real quickly?
So Charlie battled heart disease for 20 years and unfortunately lost it. And so this is in recognizing and in remembering what he did. And so there's a motorcycle ride on Sunday, and to raise the awareness of heart disease as the #1 killer for Americans.
Dr. Bruce, thank you so much. We appreciate you coming on the show. And if you're interested in taking part in Charlie's Ride, we'll have all that information on our website, ctnow.com. Rachel, over to you.
All right, Sarah, so far so good. No complaints this morning, but this will definitely change later on today with the event at the Comcast Theater, so definitely keep that in mind as you're preparing to head home this afternoon or if you're trying to get an early start on the weekend. So